welcome to Dr. Brandy's Pearls. This is a podcast and a YouTube channel that I have created specifically for nurse practitioners, whether you're a student, whether you've been working forever, or you're brand new. And it's also for our patients. I feel like we need to work together and we need to learn together in order to better navigate our healthcare. So for nurse practitioners, I feel like this will help them to be able to learn more things that they may need to help to progress in their practice, maybe even give new information, and also start a discussion. And for our patients, it's giving them a little area and platform to give feedback to even us as the nurse practitioners, or even know what they need to be asking their providers, whether it's an MD or a nurse practitioner or even a PA, what they need for their actual care and how to address those things when they're dealing with them. So this particular show today is going to be about sexual dysfunction, something that I've kind of had near and dear to my heart for a little while now, and I've done a bit of research on and have worked with several different people in the area on some different aspects of that. And I think the biggest issue with sexual dysfunction is, guess what? It's not talked about. Providers don't ask about it at all. We don't even bother to say, how is your sex life? Are you having sex? Unless they're there for something that has to do with that area not functioning correctly. And the truth of the matter is that is one of the biggest taboo sections of healthcare, and it shouldn't be, because it's important. It's part of our life. It's part of our Maslow hierarchy of needs, and we need to address them with our patients, and patients, you need to address them with us. You shouldn't be afraid to come and say, hey, I've been having a lot of trouble with, having an orgasm. I've been having a lot of trouble with vaginal dryness. I've been having a lot of issues with my manhood. It doesn't matter how you put it, it needs to be addressed. And it should be. It should be one of those things that we ask about, just like we're being prompted to ask more about depression when people walk in, which it should be something that should be part of those general questions that we ask our patients. Sexual dysfunction can be something that people will live with for years and never have that part of them satisfied. And that is a problem, because it can lead to some type of stress. It can lead to some type of depression. It could be little things that can help progress our patients and make them happier, make their quality of life happier or better if we just ask about those things. Now, why is it that we have sexual dysfunction? Well, there's many things. We have things such as just general health. We have actual medications. Sometimes we have just lack of knowledge. We have stress. Sometimes it's just the way hormones are working in our body. We have various things that can make us not have that sexual desire, not have us lubricate, and not have us have an erection, not have an orgasm. And we have to understand what those things are for patients, because sometimes when we're just working with them and trying to work on the exact disease process, we're not looking at the whole picture. Because if they're sexually active or want to be sexually active or haven't been in a while because of something that has been going on with them, we need to address those things with our patients, and we need to talk to them about it. We don't want them to be afraid to come to us. And one of those things as a nurse practitioner, and that patients should also understand, is we're holistic. That is our goal. That is how we were taught from the very beginning. We were taught from our associate's degree on up to think of the whole patient, mind, body, and spirit. So your body is important to us, very much so. And we need to know what those things are that are bothering you. Everything doesn't have to be fixed with a medication, because sometimes it came on because of a medication. But we do need to know what your true issues are, and providers, we need to ask about them. We need to know, what is the true problem? Is it a lack of communication between you and your partner? Is it a lack of feeling sexy? Do you feel like, since you've gained weight, you're not as sexual, or you're not feeling that way? Are you having true menopause or other physiological issues going on that's causing you to not be able to lubricate, or get an erection? Do you have a lot of stress? You had something, significant going on in your life? Are you just uncomfortable with sex? Do you have a lot of internal desires that you're scared to actually allow to be unleashed, in a sense? It's so many different things. And I know it seems like, well, that seems like that's kind of too far with a medical visit, but it's really not. Because the truth of the matter is, those that kind of focus on those things, like sexual therapists, even certain types of massage therapists or yoga instructors, focus on sexual dysfunction, in a sense, but they help you to unleash it in a different way. And those things still come down to physiology. They still come down to, how is your mind functioning? What things do you eat? Do you exercise? Are you on medicine? All those things matter. So we have to ask the questions. We have to be a little personal. But we also have to make our patients feel comfortable. And patients, you have to feel comfortable with your provider. So if you don't feel like you have that link with that provider, that probably isn't the right provider for you. And that means in everything, because you need to feel so comfortable with your provider that they're like a diary to you, that you can go to them and you can have certain conversations with them. Can we fix every little thing? No. But we can definitely help you get into the right direction. We can definitely advise you and counsel you into the right direction if we can't totally 100% fix it in our scope. Do we do everything with medication? No. There are plenty of other ways to take care of sexual dysfunction, as well as other issues that people may have. Everything is not made for just medicine. So, let's talk about some options that you could have. And let me state that there are plenty of sexual dysfunction questionnaires that are available. There's some that's specific for men. There's some that are specific for women. And then you can also make up your own, something that's maybe a combination of, and not separate them out. Because, a lot of times when sexual dysfunction comes on, you may have one person as your patient, but you don't have the other. And, that may be something you have to think about. Can you bring your husband or your wife into this visit? Let's have a conversation together. Let's see what we can do together. Because just like weight loss, which is going to be the next topic, we have to work together with the people in our home. Whether it be the whole family working together, or it's our spouse, or whether it's just focused on our child, we have to work with our child. We have to be doing some of the same things that we're telling our children to do. It doesn't just take that one person unless they're by themselves totally and they have no choice but to do everything by themselves. But most of us have a family, or we have a significant other, or we have other family members that are a part of why we're where we are, or having the issues that we're having, or that's part of our care plan, or I'm sorry, not care plan, but our care team. So make sure that you involve the people that need to be involved in the care. That's important, first and foremost. And get a questionnaire, get some information, not just medical, but ask about sexual health. Some people it would be easier for them to write it down on a piece of paper than you actually questioning it. Now, after the fact, when you have to question them, they might still be a little, apprehensive about answering certain questions. However, truth of the matter is, they will actually answer you and tell you if you seem concerned and generally are ready to have that open dialogue with them and listen to them and help them. And again, patients, you can't be scared to have conversations with your providers. No, we don't want to hear a lot of the stuff that you tell us sometimes. However, the truth of the matter is, some of the stuff that we don't want to hear, we need to hear in order to help you. Those little clues sometimes make a big difference on how you're going to move forward and how we're able to help you. So let's just say we have to disclose stuff sometimes that we don't want to hear. And me, even as a patient, I have to tell stuff I don't exactly want to tell somebody. But, in order for them to truly help me, I have to tell them. So, sexual dysfunction. We have, as I stated, various reasons why that those things come up. So, not to get too much into the physiology part, because I still want to keep this kind of light, we have to understand that there's physical changes. We have different hormones. We have different organs of our body that produce these hormones that cause these different changes in our body. So remember, blood pressure, diabetes, depression, weight, hormones, or issues with your thyroid, not just your menstrual cycle, but you have your thyroid for men and women. It can cause true sexual dysfunction issues. You know, now you have some of your outside things, just the foods that you eat, the lack of water, the lack of exercise, the lack of communication, you know, the lack of circulation in your body as a whole can decrease can cause sexual dysfunction and decrease sexual desire. So we have to figure out the root cause of these things. And though that is something that is very important when it comes to sexual dysfunction. Okay? So, let me talk to you about non-medical things. Non-medicine, should I say, because we know that there's hormones out there. We know there's Viagra. We know that we can give you some testosterone. We know we can give you some estrogen. We know we can give you these things to help that. But what about stuff that does not have to be done that way? What if I can't have those things? And what if it's not so bad that I need that? Well, we have other options. Some of those options can be as simple as lubricants. Lubricants for women is so easy. You know, it doesn't have to be anything smelly. It doesn't have to be anything that has all these scents and so forth. Just a simple lubrication can fix a lot of that. And using that. You also have things like just simply going out and exercising, getting it in during the day, you know, or even before the, you know, evening comes, if that's when you usually are with your mate, and just having a good exercise. It increases the blood flow throughout. Women have to have blood flow to their vaginas as well as men have to have it to their penises. So in order for that blood flow to happen and have good circulation, we do have to exercise. We do have to keep our arteries and veins open. And the only way to do some of those things is by eating healthy, drinking water, and exercising. So those things do matter, and you need to make sure those are part of your daily habits. We have to think about our head. Our head matters. If I'm always thinking about work, or I'm all stressed out about money, or I'm stressed out about, you know, whether someone wants to be with me or not, you're never going to feel satisfied. You're not going to feel comfortable having sex. You're not going to be into sex. It's always going to be something on your mind. So having somewhere to have an outlet, whether you keep a voice journal, whether you write out a journal, whether you have a counselor that you see, or you find a way to have more open dialogue with the partner that you're with, whether you just go take a walk to kind of clear your head and let your mind be free of your worries, you know, little things of that nature can help increase your sexual function. It's not always something that's horrible, but we have to find other ways to get us into the mood, because our body is nothing but hormones, and some of the simplest things help increase those hormones. They really do. You know, alcohol, for some, it enhances it, and for others, it decreases it. So you have to figure out where that is, and you can't be somebody that drinks a lot anyway. Otherwise, you're going to have that effect of decrease all the time. Other things you can do, I have a massage therapist that I know. She does tantric massages, which is really about sex, helping you with your sexual energy, helping you know your sexual pressure points and points in your body to help get that flow going. And that's just something that's natural. That's something simple that you can suggest to patients to try out. You have sexual therapists that you should probably partner with, or that patients can even look up and meet with, and help them kind of figure out some sexual, those therapists can help them figure out what things they need to explore. And some people just need therapy. And I mean that in a general therapy, because sometimes we have traumas. We have childhood things that bring us to this point that where we just have not been able to get past it, where we can, you know, enjoy sex and be okay with sex and not make it feel like a job or feel stressed about whether or not we can do this, that, and the other. And those little things can make a difference so much. So much. Now, for some other things that I have been experimenting with myself for other patients, and that I think is going to be a great thing, is doing IV nutrition. IV nutrition is awesome. Besides being an overall actual healthy option, you have actual vitamins and minerals and amino acids that are in there that can help blood flow. They can help blood flow to the genitalia. They can help blood flow in the brain. They can help increase your mood. They can give you more energy to want to even have sex. Some of us don't even have the energy by the time the end of the day comes and we're home with our spouse. We've spent so much energy on everyone else. I'm not going to tell you my exact formula because it's something that I especially made. But I will say this, that there are particular minerals and vitamins that we don't get through our foods, and that going through our bloodstream is so much easier, and it can really give us everything that we need. And it's not something you need every day, it's something non-medicine, and can go with whatever you have. Most of the time, whatever is going on with your body, more or less, and you should be fine, unless there's a true kidney or heart problem that would, say that you can only have so much fluid in your body. But these are things that you could do once a week, once a month, once every couple of months if it's really needed, depending on your body. Awesome. It really is. For women, there's a yoni egg. And I know many know about it, and there's many that don't. And I know there's many in the healthcare field that don't know anything about that. And a yoni egg is actually a gemstone. It could be a jade. It could be a rose quartz. It could be an obsidian. It could be various stones. However, the amethyst and the jade in particular, I am very aware of and know works well, are very good with female hormones. And it's an egg that actually women can insert into their vagina. They can wear it all day. They can wear it sometimes. They can wear it at nighttime and take it out. It's been said that they can have sex with it as well. However, the purpose of it is just like any other natural mineral that we would utilize in other areas of our life or in foods and so forth. It has its own natural properties that help to balance out female hormones. It can help with vaginal lubrication. It can help strengthen and tighten the muscles in the vagina, which is awesome. Sometimes it can even help with menstrual cramping and pain. Some people are very much in pain when it comes to endometriosis or periods or fibroids. It can help decrease some of that, and those things can help. So I would try some of these things out and see how they work for you. You don't have to always utilize medication to get where you're trying to be. And if you are a female with some type of endometriosis and or fibroids of some nature or some type of prolapse, get checked. Ask them to help you. Don't tell them, take out my uterus, because you shouldn't want that. And don't let them tell you that's the only option, because it's not always the only option. But go and see if those are some things that are also keeping you from enjoying your sex life. Men, it's okay to tell somebody that you may have a low testosterone. It's okay to want to increase that. You don't have to necessarily get testosterone. You don't need to take steroids all the time. Sometimes it's just some simple little things like just relaxing a little bit more. Actually having foreplay with the person that you're with. And I mean that in the sense of just having a conversation, going out on a date. Little things like that can actually help increase sexual function. And you don't have to necessarily be sexual dysfunction. And they came up with that as an actual diagnosis for medical issues. And some of these medical issues don't necessarily have to come along with medication. Some of them are just simple lifestyle changes and simple things that you can do with your mate or within yourself to help enhance your sexual health. And sexual health is important. Again, it's part of Maslow's hierarchy of needs. We were made to be creatures that mate. And it helps. It's a very good stress reliever. It also helps us to lose a little weight. I know you guys didn't believe that, but it is. It helps increase your metabolism. It increases your endorphins. It increases your mood. So these are things that can help you not just in that situation of sex, but it can help you in your life. Just little things of not being able to, pay attention to certain things, or not being able to talk to people, or having stress at work, or just feeling depressed about things. I don't know. All these different feelings and emotions oftentimes take over us. And just little things like exercising, being able to actually have sex, being able to actually be free-minded, be able to go take a vacation. Just little things can help enhance our whole health. So I want you to think about those things when you are talking with your patients, practitioners. I want you to research some of these things before you talk to your patients. And patients, I want you to research some of those things. Talk to your providers about them. We have all kinds of essential oils that you can utilize. You can just have them sitting in your home and in your bedroom and those diffusers, and it will help enhance your mood so much. Lavender, orange, you have rose oil. Like, these things can enhance your mood and give you more of that sensual feeling. You just have to try them out. You just have to be open to those different things. Just rubbing, certain essential oils on your body can help with some of that flow. Even for men, So don't be afraid to talk to your provider or your nurse practitioner. Nurse practitioners, don't be afraid to talk to your patient. Don't be afraid to ask those questions. The same questions, hard questions we have to ask sometimes when someone's coming in because something's wrong with them down there. We need to be asking even if we don't know if anything else is wrong with them at all. Those things are important. When someone comes in and talks about depression, sexual dysfunction should be one of the first things you should be asking about outside of that. Actual general questions. If someone comes in and tells you they have blood pressure and diabetes issues, you need to be asking about sexual function and depression, because a lot of times those things are affected, So let's try to help people have a full quality of life in every area that we can. We can't fix everybody per se, but we can help guide them. We're actually not just practitioners and providers. We're almost like life coaches, not just about the body, but we're telling people how to do lifestyle changes, how to do more, how to generate better lives and have a better quality to live longer and have more. So know that it's not just about their body that we're always talking to them about. We're talking to them about everything that makes them who they are. So let's push forward. Let's be the trendsetters. Let's be the people that make a difference in our patients' lives. People come to us and trust us with so much, and they should be able to trust us with this too. This should not be a taboo subject. This should be a subject that we should be able to talk to anyone about. I encourage you to take on other things, like maybe looking more into sex therapy, just finding out more things about it. You don't have to be a sex therapist per se. Look a little bit more into life coaching, things of that nature to kind of help enhance some of your interviewing skills and your counseling skills. But we are truly counselors by trade and just by our nature, because most of us that become nurses or nurse practitioners have this need to help, and our patients are drawn to us for a reason. And I know that me and my practice, I keep it small, and I want it small because I want to be able to spend time with my patients. I want to be able to spend 30 to 45 minutes and have a conversation with you for your visit and really get to the nitty gritty. Can I solve every problem in one visit? No. But I definitely can get more from you than spending 5 minutes or 7 minutes or having someone knocking on the door telling me I got to come out and see the next person if I have that time to actually spend with you. We can actually have a true plan to get you moving forward and having a better quality of life. So, again, as you guys move forward, think about new things that you can add into your practice. New ways to connect with your patients. I promise you they will stay your patients for life. They will love you. And patients, you will definitely not ever want to leave that provider that can actually give you that 100 holistic feeling. And I know that. People want to be heard. Thank you so much for joining me with Dr. Brandy's Pearls today. I will definitely be back very soon with another topic. And if you have comments or questions, please feel free to leave those comments and questions. Also, know that I'm open to any suggestions of topics that people would love to learn more about or hear more about. And all of my topics will be just varied. They won't always be patient focused. Sometimes they'll be business focused. Sometimes they'll be specifically for practitioners, and sometimes they may just be specifically for patients. But I feel like I have that platform to give other people some of the knowledge that I know, and I've gotten a lot of feedback from many providers and patients about things that they have concerns about with their health and with dealing with, their providers. And I want to make sure that we all know about these different things, and that I'm able to share them with as many people as I possibly can. Thank you so much, and you guys have an awesome, awesome day.